are back on the record at 4:07 p.m.
All right, I believe when we broke, we were talking about the autopsy report, which is SFMC 0031,
Yes.
2 and 3, right?
Yes.
Which we marked as 10.14. All right.
Mm-hmm.
Now, the autopsy report was prepared by, let's see, this Amir Hamami, right? The director. So you don't know?
I see it.
Yes, ma'am.
Yeah.
Do you know him?
No.
Okay.
No.
It reads here that the reason for the autopsy was that it was requested by the family. Is that right?
That's what it says.
Okay. Do you have any idea why it reads requested by family?
I have no idea why that's there.
Okay. Final pathologic diagnosis here, stillborn female fetus. And stillborn means the baby was born dead after 20 weeks, right?
Mm-hmm.
Yes?
Yes.
Okay. Now, when you operated that morning of the 22nd, we'll get to your note, but I believe you wrote that you actually thought there was a fetal heart tone, a fetal heart rate for the baby, right?
I don't remember that. We can look at the note.
Okay, we'll look at that. That's fine. And what's your understanding about what the cause of the AZT delay was? You may answer.
I don't know.
You don't know why?
No.
You just knew that it was delayed?
Right. And
Okay.
sometimes medicines are delayed from the pharmacies. So.
Okay. You don't know whether it was unavailable or an issue with the pharmacy or
I don't
pharmacy?
remember.
Okay. Do you remember someone sharing with you that the AZT had been delayed?
I don't remember that either.
Okay.
Well, what do you mean, like a nurse? The
Yes,
nurse
ma'am.
did. Yeah, the nurse did.
Okay. And what did the Southfield Medical Center nurse tell you about the AZT being delayed?
No, I don't remember that.
Okay.
But she did share because remember we were trying to call to see if it had gone in
Right,
and it hadn't.
right.
So, yeah.
And if the AZT had been available, that would have been started not after 6 o'clock, but as soon as the patient got there, around 3 o'clock, true?
Yes.
You would have ordered it to be started, 3
Well,
hours
it was
earlier.
ordered, so it would have been started, yes.
Okay. And then the patient would have been ready for you to deliver the baby at, between 7 and 8 o'clock that night, true?
If it had gone in for the 3 to 4, yes.
And you would have delivered the baby in that case, true?
Yes.
Okay. Between 7 and 8 o'clock that night, true?
3 to 4 hours, yes. After
Okay.
it had gone in.
Well, between 6 and 8, I guess.
Yes.
Okay. Now, the final pathologic diagnosis, a stillborn female fetus consistent with 37 weeks gestational age by measurements, true?
True, that's what it says.
Yes, ma'am. And when you delivered the baby and you held the baby, albeit momentarily, the baby seemed to be a normal size to you.
I can't remember that.
Okay.
Yeah.
And again, the pathologic diagnosis, no external anomalies, true?
True.
No internal anomalies, true?
True.
Which that means in those respects, the baby was more or less normal, true?
True to what this is saying?
Yes, ma'am.
Yes, true. That's on
Okay.
the paper, yeah.
And you would agree with that, right? Based on your delivering the baby.
So when you say normal, you're saying there were no findings of death or?
Well, no, this is an autopsy, so the baby's
Okay.
already dead.
Right.
But the final pathologic diagnosis, I'm just walking through A to H
Okay,
here.
okay. There were some external concerns. The fetal scalp, like I told you, very soft and mushy.
Okay.
And the amniotic fluid, I can't remember exactly, but it was like brown greenish. It was a
Okay.
chronic, finding.
Okay.
Like something had been going on.
I don't remember where you indicated in the notes that the amniotic fluid was brown or greenish.
I have to look. and
Okay.
see. And I may just not have put everything.
All right, I understand. Now, final pathologic diagnosis, well, you agree with A, B, and C, true?
Anomalies, I don't remember any. I can't recall.
Okay.
I just can't recall.
Okay.
So I can't
And D is skin slippage most prominent over shoulders and preserved hepatocellular nuclear membranes consistent with a few hours, less than 24 hours interval between fetal death and delivery. True?
That I can't comment on because I didn't do slides or anything. This is his finding.
Okay. Any reason for you to doubt the
Oh, definitely.
pathologies?
Definitely doubt
Okay.
it.
Okay.
Definitely. It's
And
just one of those where it's inaccurate.
Okay.
Yeah.
The autopsy report's inaccurate.
It's
Yes, ma'am.
definitely inaccurate.
And then F, congested airless lungs with normal histological staining characteristics. So the lungs were normal, true?
That's what
Okay.
we found there.
And you didn't observe the lungs, so you wouldn't have any idea about that, right?
No, I didn't open up the
Right,
the
the baby.
and all that.
You would defer to the physician who performed the autopsy for those findings.
Right. That's something they do after the surgery and everything.
Then hepatomegaly with marked congestion and prominent vacuolation of hepatocytes consistent with acute intrapartum asphyxia. You know, what is acute intrapartum asphyxia?
Acute meaning just
Sudden?
sudden. Yeah.
Yes, ma'am. Intrapartum?
And intrapartum is in labor, but hepatomegaly, so he's everything got larger in an acute amount of time, is what he's saying. It's interesting. Okay.
Well, this acute intrapartum asphyxia, my understanding acute means sudden as opposed to, as you suggested earlier, chronic. Intrapartum, the baby's still in the mother's womb, and asphyxia means that the baby's being oxygen deprived for some period of time until it dies. True?
True.
And those were Dr. Hamami's findings, right?
Yes.
Any reason to suggest that those are inaccurate or wrong?
Well, only because what I found on intraoperative findings
Yes,
that I
ma'am.
made, there just may be some error.
Okay.
And the hepatomegaly, I don't know how that could be something that occurs in an acute period of time. But
Well, that's
interesting.
You're talking about the liver, right?
yeah,
Okay, enlarged liver a little bit.
yeah.
Okay. Placenta with umbilical vein, luminal thrombosis. You know what luminal thrombosis?
Filling the entire diameter of the vessel.
And please see case discussion. That's the rest. Let's see. Or do you still have privileges at Emory Midtown?
This January, I relinquished them because we have to, do things to keep them up, and I'm not practicing. So
Okay.
right now,
So January 2014.
yes.
Right. Do you know who Karen Zachary is?
No,
Never heard that name?
don't recall it at all.
Okay. To my outline. Just looking at my notes. If you would turn to 145, SFMC 145. Here at 2230, IO interventions, patient sitting up to eat, low-calorie dinner tray. That's what you ordered, right?
I don't recall ordering it.
Okay. Look at, let's see. after 10 o'clock that night, you weren't called again until 6:30 that morning, right?
That's what the notes indicate, because I can't remember.
Okay, if you look at SFMC 0148, see that?
Okay.
Okay. And so this was the next time you were contacted, right?
Yes.
And that, let's see, at 6:30 on May 22nd, 2012, so it's the following morning. Call page placed to provider. Dr. Whyte notified of patient status, orders received, right?
Yes.
And it looks like a stat ultrasound called, right?
Yes.
Now, even if the patient's not on electronic fetal monitoring, they can still use an ultrasound to try to find the baby's heart rate, true?
Yes.
Okay, and was that done here?
Yes.
Okay, throughout the night?
That wouldn't be standard of care to do it throughout
Okay.
the night.
So for those 8.5 hours from 10 that night until 6:30 the next morning, you were not contacted by anyone from the hospital regarding Angel Mala, true?
True.
Okay, you weren't contacted by anyone from the hospital or otherwise regarding Angel Mala, true?
True.
Okay. And look at your operative report. It's 0034.
Oh, I have it right here. Mm-hmm.
Whichever one you want to use to file with me. I'll just mark one so we got thank you. Just anywhere on the bottom is fine. Thank you.
Mm-hmm.
We marked that as 10.15, is that right?
Yes.
And that was, that's your operative report?
Yes.
You prepared that?
Yes.
And you dictated it, if you look on the last page, May 23rd, 2012 at 9:38 in the morning?
Mm-hmm.
Yes?
Yes.
And looks like it was transcribed 2:30 that afternoon, is that right?
I'm sorry, let me look
That's
at
all
the
right.
page.
Yes, ma'am.
Yes.
And then looks like using your dictation ID, it was read or confirmed May 23rd, 2012 at 15:35, is that right?
That's what it says.
Okay.
It's kind of soon.
Down at the bottom, authenticated and edited by Lilith Whyte, that's you, right?
Yes.
On May 23rd, 2012 at 6:55:48 p.m. Central Time, right?
Yes.
Any idea why they're using Central
I
Time?
have no idea. Maybe they're located in the Midwest region or
whoever's doing
somewhere.
that,
I don't
okay.
know.
Do you know what edits you made on May 23rd, 2012?
Remember, I was mentioning to you before that that language is used, but it doesn't mean you necessarily
Okay.
changed anything unless
ma'am.
you just saw spelling. You know, sometimes they may
Got it.
get the wording wrong.
All
How
right.
you?
You don't
Say it.
recall making any changes?
I don't.
Okay. So here, according to your operative report, the preoperative diagnosis, HIV positive, 36 weeks, 6 days gestation, non-reassuring fetal heart rate status, true?
Yes.
That's why the patient was admitted, right?
And that's why they were delivered when they were.
Yes, ma'am.
Yeah.
And that's, Dr. Page confirmed when he spoke with you on the telephone that afternoon that the baby had non-reassuring fetal heart rate, true?
It needed to be, the patient needed to be admitted to
Yes,
be
ma'am.
delivered by C-section.
Yes, ma'am.
Yes.
Okay. And, of course, you've also indicated the patient has diabetes.
Right.
Late prenatal care, which we discussed, patient reporting some questionable decreased fetal movement upon admission, right?
Right, and also the late prenatal care and noncompliance with her prenatal care and antiretroviral therapy for HIV as well.
Yes, ma'am. This questionable decreased fetal movement upon admission, what do you mean by that?
Where is that? I'm sorry.
I'm sorry, number 4, right there?
Oh, she wasn't sure.
Okay,
She was vacillating back and forth.
okay. And then the postoperative diagnoses, number 5, fetal demise evidence, demise well over 72 hours, consistent with gross characteristics of fetus visualized at delivery. True?
Yes.
And by that you mean, based on what you saw, the baby had been dead for at least 3 days. True?
Yes.
Well over 72 hours, right?
Yes.
Okay. Patient admittedly states that she did not feel her baby moving for 3 to 4 days in retrospect. True?
Yes.
Which was consistent with your view that the baby had been dead for over 3 days when you
Yes.
delivered the baby. True?
True.
Okay. You didn't speak to Angel Mullen before you delivered her baby. Did you have any conversation?
Yes.
Sorry,
I
I did a poor job with that question. Let me try, see if I can do better. Or he can probably help me do a really good job. But so the morning of May 22nd, 2012, before you took Angel Mullen into surgery, did you have any conversations with her then?
Yes, I have to. As a surgeon, I have to consent her. So
Mhm.
that's the first thing. And then just explain what's going on and,
Okay.
just talk to her.
All right. So when you got in, you talked to her. What did you say?
I don't remember in detail, but definitely because there's a risk that the baby may have been dead already. I asked her, if that's the case, do you still want this cut on your stomach?
Okay.
And she said, I want you to try everything you can possibly do, just in case it's alive.
Okay. She wanted her baby. True?
Now that I don't know. That's an assumption and a judgment that I can't answer.
Based on what she told you, she did.
Yeah, that statement she made, yes.
Okay.
Not based on her history.
Do you recall any conversations with her on May 22nd, 2012, other than what's in the record?
No.
Okay. You don't have any recollection of talking with her that day at all?
Outside of the hospital?
No,
Or
no.
you mean-
Outside of the record?
No.
Okay. Do you recall calling her, do you recall any discussions with her regarding the autopsy?
Yeah, when I signed her for it, the same routine gestures we make with everybody that has a baby that comes out with fetal demise, just asking them, do you want an autopsy? And she refused.
She said no.
She said no. She signed
Nothing
no,
else.
and she
Okay.
said no.
Okay. Do you recall some physicians going into Angel's room that morning after you did the surgery?
No.
Okay.
But I know that was, now that you're saying that, that was told to me, either by her when I saw her the next day,
Okay.
that she was wondering why they were pressing her to get an autopsy.
Do you recall saying
Yeah.
anything to her, anything akin to, what the fuck?
First of all, I don't curse.
Okay.
Okay.
All right.
So, no, I don't, it wasn't, there's no recollection. That was an absolute no.
Okay. And what
Yeah.
about that?
It's not professional, and it's not
Okay.
something I would do.
Do you recall telling Angel Mullen that she would need your approval to get an autopsy? Anything like that?
No,
Okay.
because there's no approval from anyone. It's the patient's consent or non-consent.
Okay.
And she refused.
Okay.
Yeah.
Do you recall placing any call to her that morning in her hospital room?
Placing her a call.
Yes, ma'am. Calling
Well,
on the phone.
I can't recall, but I know from time to time I'll call my patient and say, I'm on my way, coming,
Okay.
like that.
But you don't recall any conversations with Angel Mullen in the hospital on the May 22nd, 2012? I mean, what was said other than
when
what
I
you
came to
shared with-
assess her, I know I speak to him, and I, just
Okay.
try to have good bedside manner, just see how she's doing. She just had a death of a fetus, so I'm sure
Right.
we talked.
After the surgery.
That's when we realized the baby was dead. So
Right.
yes.
So you're sure you talked, you just don't remember what was said.
The routine assessment of a patient and the routine sympathy I would do with a patient that's lost a baby.
Okay. So what you're telling me is you did what you would normally do, true?
Exactly, right.
But you don't have any specific recollection about your conversation with Angel Mullen, true?
True. I just remember she was disturbed. I can't remember the details, but she was disturbed because there was some conjuring up of some physicians asking her, telling her they could, I have no idea, like, I don't know all the details, so I won't comment, but they were trying to compel her to get a autopsy.
Okay,
Is this
so
after
tell me
your
about,
first conversation with
oh, if you have an objection, no.
You're mixing conversation.
No.
The record's will be unclear.
No, I'm not. No, we're
You
not.
are?
No, we're not.
Well, let her explain.
Do you have an objection?
I do.
Okay, what is it?
You're misconstruing and mischaracterizing, confusing the witness.
Okay.
Multiple conversations.
Would you read back the answer, please?
You know, listen to his question, make sure you answer his question.
Okay.
About which conversation he's asking you about.
Okay.
Okay, question was, but you don't have any specific recollection about your conversation with Angel Law. True? Answer true. I just remember she was disturbed. I can't remember the details, but she was disturbed because there was some conjuring up of some physicians asking her, telling her, I have no idea, like, I don't know all the details, so I won't comment, but they were trying to compel her to get an autopsy.
Okay. So on May 22nd, 2012, there was some conversation that occurred regarding some physicians trying to compel Angel Mallon to get an autopsy. Is that right?
I believe, if I can remember, it may not have been a group of them, it may have been just Dr. Booker. I can't
Dr.
remember.
Booker?
Yeah.
What's that? Do you know is Dr. Booker a male or female?
A female.
Okay. Do you know Dr. Booker's first name?
Carla.
Carla?
Mhm.
Yes. And is she a neonatologist, OBGYN?
OBGYN.
Okay. Do you know who she works with?
Herself.
Okay. Is she part of a group or?
I don't know.
Okay. Is she a friend of yours? No.
I know her
Okay.
because we see each other in the hospital. We don't go out.
Okay, got it. So did you have any conversations with Dr. Booker about Angel Mallon's baby's autopsy?
I don't recall. I don't recall.
You have some recollection of, is it your understanding that Dr. Booker was trying to get Angel Mallon to get an autopsy?
For some reason, I think so. I don't know.
Okay. And what makes you think that or recall that?
Because of the patient's anxiety when I came. And the patient, I don't know. I think she stated something similar to that. I can't remember.
Okay. Did you disagree with Dr. Booker's view that Angel Mallon ought to have an autopsy?
I didn't agree or disagree. I said, well, do it if you want to do it. And she said, well, I don't want to do it.
Angel Mallon said
Yeah,
that.
yeah, she didn't want to do it, but I
Okay.
don't know what, I don't know.
Okay. Do you recall any conversation with Angel Mallon that had anything to do with an autopsy costing $500 and her not having the money to do it?
I don't even know how much it costs.
Okay.
I just know that it does cost, because, I would always reference the nursing station, because I don't know those logistics. I would just say, does it cost or it doesn't? And it does, just like it does at Emory Midtown when we do the same procedure with their fetal deaths over there.
What does it cost at Emory Midtown?
Oh, I don't know the amount. I just know that it does cost, and that's usually a deterrent for patients. They're like,
Okay.
what's the point? Because they're on Medicaid, they usually don't have money to,
Got it.
pay for it anyway.
Do you have any idea why it was done for free in Angel Mallon's case?
I don't know.
Okay.
It's weird, but I don't know. Because the patient actually came to me postpartum, and I just don't remember, because I know I did follow up with her,
Okay.
6-week postpartum, and I have to sit back and think about it. I probably can. I don't know.
When you did the C-section on Angel Mallon, did you use a vacuum?
I don't know.
Okay. You don't use vacuums on C-sections.
Well, we wouldn't have been able to in that case, because
Okay.
the head would have been decapitated.
All right.
We couldn't even put it on.
Right.
Apply. But no, I use vacuums in C-sections. No, we can use them.
But
not
not
in
in
that.
this case.
I don't remember it being any difficulty. Like I told you, it
Okay.
was a sponge.
Got it.
It just
Got it.
came on out.
Got it. Any idea why Southfield Medical Center would bill Medicaid for a vacuum in Angel Mallon's case?
I don't know. Maybe, I don't know.
Okay.
Maybe it was an error, or
Okay. Have you heard of
maybe there
Southfield
was
Medical?
vacuum. I don't know.
Have you heard of
Never.
South? Go
Okay,
ahead.
Go ahead. I don't remember if we used a vacuum. But go ahead.
You've got an operative note, you can look at your
Yeah,
operative note. Here
right.
it is. So, use the vacuum. guess or speculate.
Okay. Well, I'm sure if they put it, we may have
cracking me
used
up.
one. I don't
What's
know.
that? Do you see the
If
word
they
vacuum in
put
your operative
that,
note
We
anywhere?
may have used it. No, I don't see it, no.
What are y'all laughing?
These lawyers trying to,
No,
funny.
Like you're coaching a little bit there, Paul.
What, you're asking her to read her record?
no,
And
he's
not
just,
speculate?
You do a little
What
coaching.
rock did you crawl out from under? I mean,
Whoa,
that-
Paul. None of that bullshit.
I'm not
That's
having you
ridiculous.
laughing in my
Don't say what
conversation.
rock that guy called.
Well, I'll say
Apologize.
what I say.
Apologize. Okay. Show me where vacuum appears in your operative note.
I don't see it.
It's not there.
Okay. If you'd used a vacuum, would you have included it in your operative note?
Usually.
Okay. Would you read back that rock crawled out from under?
What are you laughing at, man?
Laughing at you guys.
You, no, you do too.
Hold on, Gene. It's all right. What's funny about, 8
You
dead
were the
babies,
ones laugh-
Paul?
you were the ones
Oh,
laughing at
come
their
on, man.
responses.
You ever speak to a colleague of mine like that again?
Jim, I'm not worried about you.
Yeah, you ought to
Let
be.
my reputation stand for itself, and yours for yourself.
Your reputation?
Yes, sir.
Let me hear what he said to Gene.
You're wasting my client's time and your
It's okay.
time on the deposition. You think you're gonna intimidate me by staring at me? Are you kidding me? That is laughing.
Do you want me to read that back?
Yes, please.
Mr. Wheeling said, what are you all laughing about? Mr. Potts, these lawyers trying to, it's funny. Mr. Butt, coaching there a little bit, Paul, and Mr. Withington, asking her to read her report and not speculate. What rock did you crawl out from under?
Okay. Go ahead. I'm sorry, do you see vacuum anywhere in your operative report?
No.
Okay. When you use a vacuum, do you include it in your operative report?
Yes, usually.
Okay. Under finding and procedure in detail, do you see that down at the bottom?
What page you on?
Okay. Yes.
You wrote non-viable fetus with signs of fetal death well over 72 hours, true?
Yes.
Means the baby had already been dead for over 3 days when you delivered it, true?
Yes. Okay.
With abdominal peeling and actually generalized peeling of skin over the entire body, true?
Yes.
Softening of the fetal skull with a lopsided skull appearance, true?
Right. Yes.
On the next page, fetal strip. Let's see. Count was correct too for needles, and the fetal strip revealed the baby's heart rate to be in the 130s to 140s, true?
Mm-hmm.
You see that?
Yes.
Is there anything missing between Southwood Medical Center, page 34 and page 35?
I have no idea.
Does there appear to be a portion of the record missing?
I'm not sure. I don't know.
Should it go from the count was correct times 2 for the sponges, lap pads, needles, and instruments, and the fetal strip revealed the baby's heart rate to be in the 130s, 140s?
I'm not sure. I
Okay.
can't comment on that.
According to your operative report, the fetal strip revealed the baby's heart rate to be in the 130s, 140s.
Yes, that's
That was after admission the previous day, true?
Yes.
Okay. And of course, if that were accurate, that would indicate the baby was very much alive, true?
If the report were accurate from the external.
Yes,
testing,
ma'am.
Yeah.
course, it's your view it was inaccurate, right?
Obviously, yeah. It just-
AZT was somewhat delayed, and according to the nurse, there were no ominous signs of the fetal heart rate tracing to indicate the need for intervention at the time. True?
Yes,
You remember the nurse telling you the AZT was delayed, right?
yes.
Remember what nurse that was?
The same one on admission, Bridget.
Okay, Bridget. And do you remember, as it turns out, it was delayed, as best as you can tell from the record, 3 or 4 hours, is that right?
Yes.
And if the AZT had been there on time, you would have come in and delivered the baby that evening, true?
Ask and answer.
You may
Pardon
answer.
me?
You've already answered.
You may
Yes.
answer.
Yes.
That nurse also told you there were no ominous signs of the fetal heart tracing, right?
Right.
And of course, you consider a category 3 strip to be an ominous sign, true?
Like I stated earlier, initially, it could just mean, depending on what the ominous sign is. If it's a decel, which, significant decel with bradycardia, which was never on the strips, that would definitely be just, don't even try to, sometimes we still try to resuscitate, but it would be a very small window to even initiate resuscitation and see if there's a positive response. But with the strips that I saw, I wouldn't have a problem waiting till the bolus went in over an hour, turning
Okay.
on the side, and getting oxygen by face mask.
Okay, but an hour, well, this is closer to 24 hours between the time of admission and the time of the delivery, true?
What happened?
The Angel Milam was admitted on the 21st at 15:20,
Right.
true? So that's 3:20 in the afternoon, right?
Yes.
The baby was not delivered until the following morning, true?
Right.
And it was delivered at
$7:12 a.m. at Elms Gym.
Yes, 7:12.
what time?
7:12, it's on the op note.
Well,
Anesthesia
record, Jim,
records.
I'm sorry, 0082.
In the labor and delivery flow sheet at 2000 SFMC 0150, unable to determine. Hold on. Baby was in page 159, SFMC 159. Rushed to NIC, let's see, was in OR at 7:11, but OR was calotic, so report was attempted at 7:39, is that right?
Oh, they mean chaotic, probably.
Chaotic?
Yes, I see that.
Okay. So the baby was in Miss Milam was in the operating room at 7:11 that morning, right?
Mm-hmm.
Yes?
Yes.
So the
Yep.
baby was delivered after that, right?
Yes, I don't know if they're saying that's when they entered, or they're just saying that at that time, they're just still talking about we're in the OR, not necessarily when they first entered the OR.
And the baby was delivered at what time?
7:12, yeah,
The following morning.
yes.
Okay. So from the time the baby was admitted at 3:20 until 7:12 the next morning was about what, 16, 18 hours.
Mm-hmm.
Yes. 16 plus, right?
Right.
Okay.
Before we,
So, Any other recollection about why the AZT was delayed?
No.
But the delay in the AZT ultimately delayed the surgery, true? You may answer.
No, not really, because if there were any signs, we would have done it regardless.
You would have done what regardless?
Delivery. If there were signs that we needed to deliver before waiting on it.
Well, right, but if the AZT had been there and the patient had been ready, I believe you've already testified that
Oh,
you would
yeah.
have come in and delivered the baby, true?
Oh, yeah, without any ominous
Yes,
signs or
yes.
anything, yes.
You wrote admit to no fetal movement for 3 to 4 days, but was in denial. In other words, Angel Mullen was in denial. Is that right?
That's what I gathered, because she said one thing, you know, pre-operatively, and then told me another
Okay.
post-operatively.
Here's your observation.
Thanks.
Let's see. Straight. If you would, turn to Southwood Medical Center 0039 0040. I'll mark that here.
I can use his when she marks it. Yeah.
Mark that as 10.16.
Whenever you get to a spot.
That's fine.
post something.
Okay. 10.16. All right, I'm good. You want to go?
Okay.
Yeah, that's fine.
Put it on here.
For
Yeah,
1 minute.
We are off the record at 4:44 p.m. We are back on the record at 4:49 p.m.
If you would have a look at SFMC 0039.
Yeah, I just read it. I read it.
Yes, ma'am. That's your consultation, true? Late entry?
Yes, just a summary, kind of what happened.
Okay. And this is, you dictated this, right?
Yes.
Dictated on May 24, 2012 at 13:41, and authenticated and edited by you on 5/30/2012 at 10:21:59 p.m. Central
Right.
Time. True?
Yes.
Now, this is a late entry on today's date. That's you, right?
Mhm. Yes.
Yes. And you indicated that labor and delivery was called by myself, and I spoke to Bridget, the charge nurse who was taking care of Miss Mullen, to see where we were with the C-section. True?
True.
And I earlier confirmed to do around 1800 to 1830 that day. True?
True.
In other words, you were going to do the C-section between 6 and 6:30 on the evening of the 21st. True?
Right, 3 hours or 4 hours after the AZT went in.
Yes, ma'am. At that time, Bridget revealed to me that the AZT had not been started. True?
True.
And as a result, you weren't able to do the C-section between 1800 and 1830 on the 21st. True?
True.
Yet, or received from pharmacy, and the IV on the patient hadn't been obtained, either secondary to the difficulty locating a vein, secondary to the patient's dehydrated status. Is that right?
Yes.
However, you asked Bridget, and she said the strip was reassuring. True?
Yes.
Nothing about a Category 2 or Category 3 or anything like that, right?
Right, on admission. Mm-hmm.
Okay. A Category 2 or Category 3 would not be a reassuring strip. True?
True.
That the reassurance was given that the strip was okay. True?
True.
He objected in full.
That's fine. You were, let's see. I would attempt to sign out to, let's see, the next progress note that occurred later that night, that was around 11 p.m. True?
Progress
Yeah.
note for who?
For, according to your note.
For me?
Yes, ma'am.
Oh, 11 p.m.
Yes, ma'am.
I don't recall, but yes, I guess I wrote it.
Okay. Says you were called by the registered nurse, thank you, saying the baby was hard to trace because it was moving so much. True?
Uh-huh.
And of course, if it No, we're moving so much, that would indicate the baby was very much alive, true?
True.
But that's in error. The nurses mistook what was going on and
Well, it was hard to tell, perceive what was going on.
got it,
It's
okay.
hindsight after the surgery, we knew what was going on.
Right.
The baby's just moving involuntarily in the fluid.
And you told the nurses that the monitors could be removed temporarily and restarted early in the morning as it was close to midnight, true?
True.
Now, when you got that call around 11 or between 11 and midnight, nobody said anything to you about contractions, true?
I don't recall.
You may answer.
I don't recall.
Okay, you don't recall anybody saying anything to you about contractions, true?
I don't remember.
Okay. You don't recall anyone ever saying anything to you about strips that were Category 3 strips, true? You may answer.
Because even if they did, we would do the bolus of fluids and just see what's going on.
Right, but and you would have given that, as you've testified, about an hour, right?
What was the question?
You would have given the bolus about an hour to
Right.
see what happened.
Yes.
You wouldn't give it 16, 18 hours, true?
No.
Okay. So if they indicated that to you, well, they didn't indicate that to you, true? You may answer.
I don't recall.
Okay.
Yeah, I
You're-
don't think so.
We went through the note earlier,
Right, no.
and I believe there were some areas where a nurse indicated to you, or a nurse indicated in the note, for instance, that she communicated to you that Angel Milam was having contractions every 3 to 4 minutes, true? That's what the note indicated, but that was false, true?
I'm not sure, I just don't recall.
Okay. Well, you testified that if the nurse had told you that, you would have gone to the hospital to deliver the baby, true?
Objection.
Yes? You may
Yes.
answer.
Or did you get my objection?
Yes, sir.
Thank you.
Even with the AFM off, you could still do intermittent fetal heart rate checks, true?
If the patient's in labor.
Right.
Yeah, that's okay. And Miss Milan wasn't in labor. She wasn't in labor.
And you didn't realize she was contracting either, true?
No.
If you would, look at SFMC 0041. You see that? Those are, we'll just mark that as 10.17. I'll let you do it. Thanks. That's your signature,
Yes.
and these were your orders at on May 21, 2012 at, looks like 15:30, is that right, or 15:20?
1520.
15:20. And here, fetal heart monitor external, true?
Yes.
So you ordered the patient to be continuously monitored by external fetal heart monitor, true?
At that time, yes.
Yes, ma'am.
Mhm.
And that was per the recommendations of Dr. Page?
For that time, yes.
Yes, ma'am. And that same time, 15:20, you ordered that AZT be started, true?
Yes.
2 milligrams per kilogram IV,
Mhm,
right?
Piggyback.
I'm sorry?
Piggyback. Mhm,
Yes,
IV
ma'am.
Piggyback.
But the order wasn't started at 15:20, true?
True.
Because they didn't have the AZT, true?
Yes.
Turn on over to SFMC 0044. Thank you. These are your orders.
I recalled when we looked at the labor and delivery strips that they hadn't called me at 8. Or did they? I don't know.
Okay, we can look at them. Here, why don't we pull them up?
I was just wondering if there was some confusion because at one point Dr. McDonald may have been called on accident because she was on call that night, but I just consented to cover the patient.
Okay, here's,
No, the flow record that says.
oh,
when
flow
they talk
sheet,
to-
sure.
Yeah.
That's in here.
Um,
I'll pull it up. You want 8 o'clock?
yeah, 8
I'll
o'clock
find
will be
it.
right here.
Okay. Or you,
It's 20.
these are 6 o'clock, 10 o'clock.
What time was 20 something?
2200?
Oh, 2200?
Is that what you were looking at, or?
Oh, okay, I thought it said 8. This is. Yeah, they did have my name on there. But I
Okay,
think there may have been some confusion because normally I would not let someone eat, even if they weren't in dire distress at that time.
Right.
So there may have been some confusion with the two covering doctors, Dr.
Okay.
McDonald and myself.
but
But I'm
you,
not sure.
Dr. Page recommended, and you agreed that Angel should have been in PO, true?
Well, that's because the C-section was going to be done earlier once the AZT went
Right.
in, but now this is a different scenario.
Right.
So things have changed. The baby's supposed to be looking reassuring, and there's no emergency in the
But-
middle of the night to.
The nurses told you they were getting reassuring strips up until 10 o'clock, is that right?
That's what it looked like on the note, the flow
Yes.
sheet. Yeah.
Right. But we've been through the strips, and that's not reassuring, true?
There were some that were reassuring, and then there were the others.
Some that were
Yeah.
not, true?
Right.
Objection upon.
If you would, turn on over to SFMC 0053. Thanks. Let's move it this way.
Oh, okay. I thought, oh, that's right, 5-3. I'm sorry. I thought that was fine.
Thank you. And we'll label that as 10.19,
9.
right? And 53, those are your obstetrical surgical brief post-op note, right?
Yes.
And it reads here, again, fetal death, well over 72 hours, is that right?
Yes.
Fetal, down here, fetal monitoring interpretation, no fetal strip. You see that? You wrote this?
Yes.
And OR and prior, 130s, 140s, right?
Yes.
But can you show me in the Plans Exhibit 10.12 where the you can establish a baseline fetal heart rate of, in the 130s and 140s?
Here's one at 1753.
Okay, and that's, for the record, that's SFMCQS 0683, and that's at what time?
1753.
Okay, so that's about 4 o'clock that evening, right?
Right. And even
No,
though
no, that's about 6 o'clock.
I'm sorry, 6. Yes.
Yeah. On the 21st.
In some of the records that you can't categorize, you can still see the heartbeat because that's different.
For the
So
record, you're
it's
looking at
0684
at,
at 1802.
Okay, so that's 2 minutes after 6 o'clock, right?
0685 at 1810.
Okay,
These are now like 120s. So that's it for the 130s.
okay, so the total baseline heart rates from the fetal monitoring strips were from 1753 to 1810, so for a total of 17 minutes, true?
For the 130s to 140s, there was an adjustment in heart rate. The baby can adjust its heart rate. So it was in the 120s after that.
Yes, ma'am.
But you asked about 130s to 140s.
Right. Out of the total 16 to 18 hours, the baby's heart rate, baseline heart rate was in the 130s to 140s for a total of 17 minutes,
yeah.
from
Yeah.
17:53 to 18:10. True?
Right.
If you would flip on over to SFMC 0054, we'll mark that as 10.20, the next page. Thank you for helping me with these exhibit stickers. That's actually 2 pages. These are your notes, right?
Yes.
This is an interdisciplinary progress record by you.
Yes.
And again, you wrote here fetal death over 72 hours, true?
Yes.
You've shared with us your thoughts on that, right?
Yes.
Then you write here fetus, let's see. It reads here, patient with questions in recovery room about fetal status, and when I informed her that the fetus was dead at delivery, she was appropriately distraught. True? You wrote that?
Yes.
And she was appropriately distraught.
Yes.
And wondered why the heartbeat. And I explained to her that the fetus was still connected to her by the umbilical cord, its life support. Is that right?
Yes.
And you mind explaining to me how we would have a fetal heartbeat even though the baby's already dead?
Just like I think we explained earlier.
Right.
That, you know, the external fetal monitor is not 100% accurate, so there is room for error. That's why we have internal fetal monitoring now as well.
Okay.
And then when the umbilical cord is not severed, we've seen different cases where this occurs, where the baby is obviously dead and not acutely dead, but has been dead even prior to admission. It may be in 24 hours in these other cases.
Okay. And the baby's still heart beating?
The baby still shows a heartbeat on the fetal monitor.
Okay.
So that's still there.
All right.
Maybe because of the connection, it's not known.
All right.
You know.
And how do you account for the baby's heart rate going up and down when it's dead?
That can happen because it doesn't stay constant. Nothing stays constant.
Okay.
Yeah.
Upon further questioning, the patient says she hadn't felt fetal movements for 3 or more days. She apologized that her history on admission was not accurate. That's what Angel told you. And you consoled and comforted her.
Yes. Yes.
Okay, thank you. And you consoled and comforted her and told her that that went along more with what you visualized when you delivered the baby, right?
Right. I didn't see that though. Is that? Oh, I see. Yes.
Okay. And then down at the very bottom, also informed patient that 90 to 95% of the diagnosis relies heavily on the history, HPI history.
History of present illness.
Right. Okay. And do you know who Reina Santos Lopez is?
No.
Okay. Not your patient?
No.
Do you know who Carla Booker is?
That was the young lady we
That's
just mentioned, so maybe she
Got
got
it.
some records confused here. That probably explains why the consent or the refusal for the autopsy form is missing. So we got records.
Part of Angel Mallon's medical records that are missing
Maybe in
her
Reina's,
file.
yeah.
Got it. Let me flip on over to 81. And mark that as 10.21. This appears to be anesthesia questionnaire. Do you see that?
Yes.
If you look down in the lower right-hand corner, pre-existing pain, how intense from a scale of 1 to 10? It's like 4. Were you aware that there was pre-existing pain?
No, and like I told you before, she tells different providers different information.
Okay.
Because the nurse didn't indicate that on her flow sheet.
And
And I didn't either.
we went through the indications earlier for nurse, based on the pain that she observed and what you'd want her to share with you about that. True? if a nurse observed an increase in pain, you would expect, in
Yeah.
Angel Milan, you'd expect her to relay that information to you, true?
Yes.
Objection for.
If you would, let's turn on over to 0121, which is the Georgia fetal death certificate, spontaneous abortion or stillbirth. You mind putting it?
Okay.
We'll mark that plaintiff's exhibit 10.22. And you completed this, right?
The part where the physician completes the upper part,
Okay.
yes, it was by the other young lady.
Okay, you completed page 2, right? Page two?
Yes,
Okay. And you completed the page 1 starting at 44, right?
yes,
Someone else completed 1 to what?
with the
30.
demographics and
Okay.
everything about her.
Did you complete the pregnancy history? Or did someone else complete that?
Someone else, that's
Okay.
someone else's writing.
So the work you did started at cause of fetal death, item 44 at the bottom of the first page.
Yes,
And you wrote fetal demise greater than 72 hours, consistent with gross findings at delivery, true?
yes,
Unknown cause,
cause, yeah.
On the next page, you indicated risk factors, HIV positive. What is this?
Late prenatal care,
non-compliance.
diabetes, and noncompliance.
Diabetes, all right. And the obstetric procedures were ultrasound, right?
Yes,
Over in the lower right corner, you wrote gross findings at delivery reveal fetal death greater than 72 hours, true?
yes,
Okay. You flip on over to 124, SFMC 124, we'll mark that 10.23, thank you. One more minute. Thank you. This is the fetal heart monitoring. This is your signature?
yes,
Okay. And this is your interpretation of the fetal heart strips for Angel Milan, true?
yes,
And interpretation, this term, IUP, she was full term, is that right?
a day away.
Okay. So you would consider that a full-term pregnancy, true?
Well, if she was termed, the next day she was 37. Yeah, she was admitted at 36
Got
and
it.
6, so she was 37 the next
Got
day.
it.
Yeah.
And then IUP, that's intrauterine pregnancy?
Pregnancy.
Yes, ma'am.
Yes.
And with fetal demise, is that right?
Right.
And you've got poor PNC, HIV positive, non-compliant, right?
Yes.
Transferred from Grady to me at 32 weeks, late PNC there, is that right?
Yes.
We've discussed the Grady stuff,
Yes.
right? Now, this is your interpretation of the fetal heart monitoring, is that right?
Well, after the baby's dead, we don't really get into that.
Got it.
Now that we've already concluded that,
Right.
I can understand that effect, so I wouldn't even comment on it.
And you weren't there, so you wouldn't have any idea about fetal heart monitoring because
Right.
you weren't there.
Right.
Step check ultrasound. We'll take this. All right. Tell me what you recall about the morning after the baby was delivered.
Not much.
Okay.
Except for, what we already discussed.
Do you tell me everything? Have you already shared with me everything you remember about any conversations with Angel Milan?
Yes, pretty
Okay.
much.
Okay.
Jim, to be clear, you're talking about the 22nd.
Right,
Because the
after.
morning after could arguably be the 23rd. I just want to make sure.
Oh,
Okay.
before the surgery or after the surgery?
No, no,
I'm not
we're
trying to confuse- I
May
wanna make sure we're
22nd, the
right
morning
there.
after the surgery, okay?
Thank
22nd of May,
Oh,
2012.
okay. I'm sorry.
Oh,
I
we're
did
saying
think
the
it
same
was-
thing,
No, I did think it was post-op day 1.
post-op.
She thought you meant the 23rd.
Like The
That's a good
day
point. We'll go
after.
through that next.
Yeah.
Okay, let's start with the 22nd, all right?
Okay.
After the, on the 21st, do you recall any conversations with any one at Southwold Medical Center that you haven't already shared with me?
The day she was admitted.
Yes, ma'am.
Only with asking Dr. Page, did he still want to wait on AZT? And he said, yeah, if everything looks good.
Okay. And that's when you learned that there was a delay in Southwold Medical Center
Right.
getting the AZT,
Right,
true?
so that's why I called him to
Got
see,
it.
well, can I just take the baby out? He
Okay.
said, well, no urgency.
Okay, you've told me everything you remember about that.
The 21st, yes.
Yes. And you don't remember anything you haven't shared with me that's not in the medical records, true?
Yes.
Okay. And now on to the 22nd, you get the call in the morning, right?
Yes.
And do you recall that call?
Not really, not
But-
details.
But someone told you that
To
they were
come.
unable to get a fetal heart tone then, right?
Yes, or they could see it and it was delayed, like bradycardic.
Bradycardia that morning.
Like, yeah, they saw it, but it was, they said they couldn't get it. I saw it, bradycardic.
Okay.
That's what it was.
So they said they couldn't see one. You said, I'll be there in 20 minutes, right?
Yes,
And you got there within 20 minutes.
yes,
And when you got there, you told them to have the ultrasound waiting by the bed, true?
right,
You went into the patient's room and the ultrasound was there, right?
yes,
And then you applied the ultrasound and you were able to get a fetal heart rate, true?
right,
Or what you thought was a fetal heart rate.
yeah,
Of course, now we know the baby was already dead, true?
yes,
And the fetal heart rate that you were able to get indicated bradycardia,
yeah,
right?
very slow.
Okay. Bradycardia is anything under 110 under
Under
Southwold.
60, under 60, under 90 rather, under 90 for the baby.
Okay.
Yeah, I had sometimes 100, under 100, but really under about 90 or under. That's
Okay.
bradycardia.
All right. And then you proceeded, well, you spoke with Angel about whether she wanted to go to the C-section. She said absolutely anything to save the baby if there's a chance, right?
Yeah, I told her there's a chance. Looks like this heartbeat looks kind of like there's really nothing there.
Okay.
But that was hard for us to judge.
Okay. So you went ahead and did the C-section.
Right.
And then you spoke with Angel some after, and you've already shared with me everything you recall about that.
Right.
Did you have any conversations with Carla Booker about the autopsy?
No,
Okay.
I don't know how she even got. Yeah, I don't know. I don't remember. No.
You just remember Carla Booker encouraging her to get an autopsy?
She probably was the interim chairman at the time.
Okay. Okay. All right. And then what other conversations do you recall with anyone at all on the 22nd?
Well, I recall her significant other.
Okay. Tell me about that.
He basically said I mean, it was almost like he knew the baby was dead.
Okay. What did he say?
And that goes along with him not being in the hospital during the whole time. Like, he wasn't even there. I saw him show up after the delivery, and I didn't know who he was.
According to the notes, he was there the whole time.
I don't remember him. Maybe when I came to the, or heard the nurses talking, they usually will tell me someone's there. They just didn't, so I apologize if he was. And when I
Okay.
came for the emergency, what wasn't clear is I don't remember him there either, but I may not recall. Usually I can remember when significant others are involved.
Okay.
He didn't seem to be much, maybe because he just wasn't, he didn't respond the way I would assume somebody would respond if they didn't know already the baby was dead.
Are you aware of nurses keeping significant others or putative fathers out of an OR? Not letting them come in to see
General
someone like
anesthesia,
Angel?
definitely you can't come in, but I was
Okay.
referring to the delivery, the room, where she was
Right.
through the night.
This, have you heard of folks at Southwold Medical Center not allowing the father to come in after the baby was dead, as in this situation?
Normally they wouldn't let,
Okay.
no.
All right.
And with the findings too, they needed to make sure that the baby looked presentable.
Okay, any other recollections for the 22nd? Any conversations with anyone at all regarding Angel Milan?
Other than what I told you already?
Yes,
No.
ma'am. Okay. What about one day post-op? You said the 23rd.
That may be when she was saying, that makes more sense. I think that's what you were trying to clarify, because the 22nd was when she was delivered.
Right.
And I spoke to her and went through the whole fetal death certificate and did you want an autopsy. And then the next day, when I probably called to let her know I'm on my way, I don't know if it was on the phone call or when I got there, but I think it was when I got there. She was very anxious and frustrated. It seemed like she had been, I don't know, harassed or something.
On the 23rd, she was upset.
Yes.
What, do you recall anything about any conversation with her on the 23rd?
Other than she felt like she was wondering why whoever was pushing this autopsy, and I think it was Dr. Booker.
Okay.
Yeah.
All right. Any other conversations with anyone else on the 23rd regarding Angel Mullen?
No.
Any conversations? Go ahead.
No. Not
Okay.
yet.
Any
Maybe Dr. Page.
Okay.
Yeah.
Tell me about that.
He seemed to be interested. I know I had some calls. I don't know dates and I don't know how long out, but he kind of, for he and I not to talk on the phone, he was and these cases to have been cases that we see all the time, he seemed to call more than I thought he should have.
Okay.
To ask me, have you heard anything about Angel Malone? No, I hadn't heard anything yet. Yeah.
All right. Any other conversations from the 23rd until today other than with your lawyer?
No. Besides with Angel Milan, you know, she came to my office for her 6-week postpartum.
Yes, ma'am.
Yeah.
Okay. Tell me what you remember about that.
I mean, she obviously had a good relationship because she came back.
Okay.
So, you know.
Well, you delivered 4 or 5 of her family's babies, right?
Well, that's why she came to me in the beginning, but I'm saying if she felt that there was some, you know, if she had some animosity with me, normally people don't go back to the obstetrician, even for the 6th week. I get a lot of 6-week postpartum patients that I didn't deliver.
Right.
So she did come back. So
Well, and she wasn't hostile towards you?
Oh, no,
at all?
no,
Okay.
she came back.
You wouldn't expect her to be, right?
No.
Okay.
I mean, unless, you know, there's some no, I wouldn't
Okay.
expect her to be.
If you would, flipping over to SFMC 195. That is a delivery log sheet. Would you put this 10.24? We'll call that Plaintiff's Exhibit 10.24. Thank you. Now, these aren't your signatures, right? These are just someone else.
Somebody
wrote them.
just filled it in.
Okay. Do you know who filled this in?
No, I don't know.
Do you have any idea why someone wrote vacuum extractor when you didn't use a vacuum extractor?
I don't know.
Okay.
They may have been confused. Because, see, that's why I was saying there are other cases through the night. And they,
Right. If you would flip on over to SFMC 0250, we'll mark that as 10.25. There we go. Thank you. This is the record from April 24th, 2012, right?
Yeah.
Okay, we've already, let's see. There's a SFMC 0276. It'd be over here. Thank you. Did you complete that document?
Yes,
Okay.
that's what we do on the electronic.
Yes, ma'am. And that's pregnant with late prenatal care, HIV positive, and DM, it's diabetes
mellitus.
with uncontrolled diabetes secondary to noncompliance with RX regimen.
Treatment regimen.
Okay.
She wasn't taking her medicines.
No contractions, cervix closed. You were also Angel Mullen's physician on April 27th, 2012 at Southwood Medical Center, the month before, right?
No, they just put my name because I'm her attending physician. but whoever's on call is the
Okay.
27th. I believe that was Dr. Braswell.
Right.
Yeah.
Did you speak with Dr. Braswell about her being there at that time?
I don't remember. I don't remember a lot.
Okay. Flip. Do you have 293? Well, it won't be in that notebook.
Okay.
Do you have the
What is it, Jim?
April 24? I'm sorry, April 27, 2012. Yeah.
The biophysical?
Yes, ma'am.
Oh.
It's a 293. I'll get this out of your way. Thanks. I'll give you this and just take that notebook.
It's kind of hard to see.
I can't read it.
Small, right?
Yeah.
So 293. That's the biophysical profiles up in the upper right corner, right?
Yes.
And that's the 4 out of 8 that we talked about earlier?
Yes. These two. This is 2 points for, 2 plus 2.
Flip on over to 309.
What is that, Jim, so I can just find
That's
it?
biophysical profile. Exam date 4/27/2012.
Okay,
Ordering Dr. Whyte.
got it.
Biophysical profile, do you see that? Fetal breathing movements, 2. Right.
Yeah, but they meant ordering doctor. They put the attending physician, but they probably made a mistake. Dr. Braswell was covering. But
Okay.
yeah, that's
So that should read Dr. Braswell up here.
Mhm.
Yes.
Yes.
And under biophysical profile, do you see that in the center there? Right there.
There is
Yeah.
there is a single entry uterine pregnancy.
Ma'am?
That reading right there.
Yeah, biophysical fetal
Oh,
breathing
yes,
movements,
yes.
FBM 2, right?
Yes, I see that.
Gross body movements 0,
Yes.
fetal tone 0, amniotic fluid volume 2, right?
Yes.
That was, what, 3.5 weeks before the May 21 admit,
Yes.
right? And you were aware of these findings, true?
I'm not sure, but
You had access to her medical records, right?
right. If I knew she was there, I can't remember if I was told that she came in one night, because if I get signed out, they may say everything went well, which it did go well with her, so they may not give
Right.
all the particulars. I'm not sure. I can't remember.
Okay. What's your understanding about why Southfield Medical Center closed the, what is it, women's unit? What was it called?
I don't know. Their obstetric ward, women's
Well,
center.
labor and delivery, NICU, women's services, I think
Well, they
it's
didn't
called.
close the GYN,
Okay.
so it wasn't all women's services. Is
Just-
that right? Yeah, I think gynecologic services were still there. People were still doing surgery and admitting. Yeah, that's right. The gynecologic services were still there.
Okay.
Just the obstetric services.
Okay, well, NICU was
Maternal.
closed too, right?
Yeah, the maternal, because they didn't have a
Okay.
baby.
All right. Without anybody delivering babies, NICU doesn't have much reason to be there, right?
Exactly.
Okay. What's your understanding about why the obstetrics, NICU, and labor and delivery were closed in 2012?
I don't know.
You get any emails, correspondence, anything like that? What's your date of birth?
My date of birth?
Mm-hmm.
6/5/66.
Okay. You know Dr. Acevedo?
What kind of doctor is that?
OBGYN.
I don't know why I'm blanking on that, but I
That's all
probably
right.
should know the person. Why?
We're just making sure we have this stuff covered here. Have you personally authored any textbooks,
No.
treatises, pieces of textbooks? Have you written anything on OBGYN? Okay. Taught any students? No.
No.
We have to, no?
Oh, no. Clinically, sometimes I help out with teaching when we were at Emory, because we have residents follow us. So yeah, we do training and teaching that.
Your students shadow you, right?
They shadow and they, learn of surgical technique, different
Okay.
things, yeah.
Anything other than that?
No,
Okay, any
Not in a
paid
classroom.
positions? Okay.
no.
Do you have a CV?
Yes.
Okay. Did you review any textbooks or treatises in preparation for your deposition here today? Any
Not
medical
really.
stuff, medical literature? Okay. The depositions you've read, you already told us about, right?
Yeah, I've kind of skimmed some of them, not really read into any of them, really.
You've been a party to a suit before. You've told me about all the lawsuits you've been involved with.
Too.
Okay. You ever given a deposition before
Yes.
in both of those cases?
Yes.
Okay. Any other depositions?
No.
So you've been deposed twice.
Yes.
Okay. Were those as enjoyable as this one?
They were shorter.
Okay. Ever been disciplined by a hospital? Had your
No.
privileges revoked,
No.
curtailed in any way?
No.
Arrested, charged with any crime?
No.
Where'd you go to high school?
In Chicago at Shiloh Seventh-day Adventist Academy.
You agree a physician must place patient safety first? True?
Yes.
You haven't authored anything regarding biophysical profiles? True?
No.
This. Where's that rules? EFM stuff. So I can do it different. This is fine. Show you what's been marked as, is the last one 9? That's all right, I got it. That's all right. Show you what's been previously marked as Exhibit 11, which are the electronic fetal monitoring policies and procedures for South Fulton Medical Center. You ever seen those before?
I don't recall.
Okay. Okay. Show you what's been marked as numbered. Is that not all of it?
Oh, sorry.
Thanks. And I'll show you what's been marked as Exhibit 12, which is fetal heart rate abnormalities. Have you ever seen those, that document? Okay. I believe when we were talking earlier, you were talking about the start and stop time of the surgery. That's included in SFMCQS 206, the intraoperative record and the electronic. Is that right? That's fine.
No, it's okay. The start of time of the C-section, you saying?
Yes, ma'am.
And the
That-
finish was 8?
That accurately reflects when you started and stopped the C-section.
From what I can recall. I can't
Okay.
recall.
And according to that record, the patient was in the OR at 6:55 that morning,
Okay.
and anesthesia was started at 6:55.
Okay.
Surgery was started at 7:06,
Yes.
and surgery concluded at 8 o'clock. Is that all right?
Yes.
Come up. Do you have the electronic record there?
I didn't know what you were identifying just then, Jim.
I don't need a second one, but
Give me a
That's
page
all right.
number, I'll try to find it.
SFMCQS 229.
What is that, Jim?
These are postpartum flow sheets. I got 4 of them.
Got it.
Yes.
Okay. Do you see here at 11:40, that's May 22nd, 2012, patient states she does not want to use PCA because it makes her sleepy and she wants to stay up to hold her fetus. Do you see that?
I see it.
Okay. Was that, were you around when that happened?
I don't recall.
Okay. Flip on over to 237, please.
And they are given the option to hold a dead fetus, so.
Right. 237. Patient states she doesn't understand what happened and that although it is difficult, she is going to be okay. Patient states that going home without infant and seeing the baby things she had bought for her daughter will be really difficult. Patient expresses that she is glad she got to see her daughter and hold her. States she is considering adoption, that there are a lot of babies that need love. Were you around for that?
No, it sounds bizarre.
What's bizarre about it?
She's glad to see her daughter, and she states she's considering adoption.
Uh-huh.
Okay. She knows the baby's dead. She acknowledges that right after the surgery, and then we have this statement.
And what's bizarre about that?
She doesn't have a live fetus, so how are we going to do adoption?
What do you mean?
Adoption. She's putting her baby up for adoption?
No,
or
no,
she's
she was
trying
going to
adoption?
adopt a baby.
Oh, okay.
It's still
I
alive?
don't know if I would even say that right after, but anyway, yeah, it's still bizarre to me.
Okay. Any other reasons that you haven't already shared with me? That's bizarre.
It's bizarre about her non-compliance, but yet the concern and the focus she's putting on things now. And then we have all throughout her records her diabetes, which she could have controlled with her medicine, was uncontrolled, which could have killed her baby a long time ago.
Okay.
Yeah.
What else?
You know, she didn't do anything to make sure this scenario didn't occur.
Right.
Yeah.
Which I think you've already shared with me. You consider her responsible in part for a baby's death as a result of that.
That's what it looks like.
Okay. And if you look at page 240, patient tearful emotional support provided. You see that at 8:45.
Yeah.
That's consistent with what you found after she learned her baby was dead.
Let's the 24th.
Yes, ma'am.
Oh, yeah, tearful, yeah.
Okay. Next page, 241, SFMCQS 241. Patient tearful, emotional support provided, taken out to car by wheelchair. Also consistent with what you observed after Angel Milan learned she'd lost her baby.
No, not taken out by wheelchair. It was, no, I don't remember anything
Okay.
extraordinary.
Okay. All right, if you would look at exhibit, it's 12, fetal heart monitoring abnormalities. You see that?
Oh, here it is.
Yes, ma'am. Do you see number 5 where it says alert physician about abnormal fetal heart rate promptly?
Yes.
Okay. Now, we talked about some of the issues with the fetal heart monitoring and how you were not notified. Would you agree that that was not done in Angel Milan's case?
Objective form.
You may
Objection
answer.
form.
You may answer.
Repeat the question.
You can read it back.
We talked about some of the issues with the fetal heart monitoring and how you were not notified. Would you agree that that was not done in Angel Milan's case?
Yes.
Okay. Did you ever get a protective order against your former husband?
Like a restraining order. That's what-
Oh, yes.
Okay. Was that in 2012?
Yes.
Okay. Was that as a result of his threats?
No.
Okay. What? You got that? Why?
I think we commented it earlier that, do I need to respond to that? Because I'm trying to see the,
Ma'am?
I was distracted for a moment.
oh,
I don't,
about the protective order and, I don't know.
I don't think so.
Okay.
So what, you're refusing to answer that question?
Yeah. 'cause
Okay.
I
On
was just trying
advice
to
of
stick
counsel,
with
right?
Angel, yeah. Milan.
I looked at your credentialing files. There are a bunch of oh, what county did you get the protective order in? That was Fulton, right?
Yes, yes, both of them.
Where are we? 13? I'm sorry.
Yeah, 13. We were in 12.
Thank you. I'll show you what's marked as 13, which is a portion of your credentialing file, which has been blacked out. And do you have any idea what was blacked out or why there?
I have no idea.
Okay. That's fine. Thank you. All right, I think I'm good. Let me just look at one other thing. Is that mine?
following the seat?
Right here.
Oh, didn't know where Moses was. I had to find Moses, he's under a rock.
And you contend that Ms. Milan was never in labor on the 21st or the 22nd, so care and observation of patients in labor would not be applicable here, right?
Right.
Do you recall having any conversations with Angel Milan about who may have left a room, about physicians going in or out of a room?
No.
Okay. What about Carla Booker going in and out of a room?
I have no, there are a lot of whisperings, but I have, I just, no
Okay.
definite, no conversations with me.
Got it. Who did you hear the whisperings from?
Oh, I didn't hear them from anybody because they weren't directed toward me, and I don't recall who the individuals were. There was a lot of stir,
Okay. And what was the stir about?
and just the bizarre handling of this case, because we've had stillbirths before,
Okay.
and then with the history of the uncontrolled diabetes and HIV, non-compliance, prenatal care appliance, why the surprise
Okay.
that you have a dead fetus.
Okay. If you would look at exhibit number 11,
Yes,
subject to electronic fetal monitoring.
yes.
The policy on page 1 of 11, you see that?
Mm-hmm. Yes.
At the top, an electronic fetal monitor or Doppler device will be applied on all patients admitted to labor and delivery. True?
Admitted to labor and delivery.
Yes, ma'am.
The misnomer with that is South Fulton's Antepartum service is their labor and delivery too.
Okay. Now, Angel Milan was admitted to labor and delivery. True?
She was admitted to labor and delivery when we thought we were going to deliver her, and then she went to antepartum status when that was delayed.
She was still in the labor and delivery unit, right?
Yes.
Okay. So as far as an electronic fetal monitor or Doppler device be applied on all patients admitted to labor and delivery, as you've explained, that's not what happened here. True? Give me the answer.
Yes, I'm just not sure where these policies, I haven't seen them before, but
Okay.
that's what it says here.
All right, if you look down below at item 2, greater than 22 weeks. Angel Milan was greater than 22
Yes.
weeks. Sorry?
I objected as well.
Okay.
Right, but we don't keep a Doppler on somebody that's not in labor all the time, that's,
Okay.
over 22 weeks. Because at 22, you said it's greater than 22 weeks, at 23 weeks, you wouldn't put a continuous Doppler on somebody. And that's
Okay.
what this is saying. So
What about at 36 weeks, 6 days?
if there's no indication to, because earlier on, everything was told to be reassuring once she got there.
Right?
So that would be an 8 out of 10, like we discussed earlier, from 6 out of 10 at Dr. Page's office, where only the non-stress test and movement were zeros.
Well, Dr. Page recommended continuous fetal monitoring, true?
For that time period.
For the time that she was in
When
labor and delivery.
admitted.
Yes.
Admitted, not for labor and delivery continually, because like I told you, labor and delivery is dynamic and situations change. Like he may have said, don't deliver her before the AZT, but if there was an ominous sign, she would have been delivered.
Did Dr. Page ever tell you to discontinue fetal monitoring on Angel
Well,
Milan?
Dr. Page
So-
doesn't dictate how I practice, so
Okay.
no, that wouldn't have even been an option. Yeah, usually they're consultants and we're the obstetrician and gynecologist
Right.
who is the delivering doctor for the fetus.
Right. He never recommended that you discontinue fetal monitoring, true?
I have no idea because we don't contact each other after he tells me his recommendation. And I look at it and adhere to it.
Okay.
If it's, within the whole realm of everything, looks like a plan that's good to,
Right.
you know,
Well,
implement.
you didn't adhere to that part, though. The
Yes, we
continuous
did. We
fetal-
had her on continuous feeder monitoring in the beginning.
Okay.
And then when it looked as if, for some reason, baby looked like it was moving quite a bit, and then the body habitus and the baby's movement were an obstacle to keeping a continuous strip. That's very clear that, I mean, in the literature, that you can take it off if the baby doesn't look like it's ominous. And you already went through the whole thing about how I did not know it was in an ominous state.
Okay.
Even though in retrospect it wasn't ominous, it was dead.
Right. It was moving quite a bit, but the baby was really already dead. True?
Yes.
Okay. If you turn to the next page, 2 of 11, that defines Category 1, Category 2, and Category 3 strips. True?
2 of 11. You
Yes,
have
ma'am.
repeated
Yes, ma'am.
ones,
Page
number
2.
ones.
Okay. Page 2.
Now we have 2.
Thank
Okay.
These definitions of Category 1, normal, Category 2, indeterminate, and Category 3, abnormal, you agree with those definitions?
Yes, and that's what I was stating earlier when you were talking about the heart rate going down, because as you can see here, 110 to 160 is normal. So that wouldn't have.
All right. If you turn on over to page 5 of 11, under procedure, all patients placed on a fetal monitor will have the fetal monitor strip checked and signed off by 2 RNs 30 minutes after being placed on the fetal monitor. True?
Yes.
B, the fetal heart rate will be oscillated for a full 60 seconds and the rate is counted in beats per minute. Right?
Yes.
Was that done here?
I can't count. Yeah, she was put on the fetal heart rate strap when she first came in. Yes. And the
Oh, you're
RNs
talking about electronic fetal monitoring.
Right.
Okay, well, that's on the next page, 6 of 11. Electronic fetal monitoring.
And what's your question? I'm sorry.
Electronic fetal monitoring is on the next page, page 6 of 11. See
Right.
that?
Yes.
You flip on over to page 7 of 11. Interpretation of data, auscultation. Reassuring fetal heart rate responses include a normal baseline between 110 and 160 beats per minute. True?
Mm-hmm.
You agree with that?
Yes.
Non-reassuring fetal heart rate responses include either of the following parameters: abnormal baseline rate, true,
Yes.
or audible decelerations, true.
True.
If you look on page 8 of 11, 2D, C2D, non-reassuring fetal heart rate responses notify physician and initiate interventions. You see that? You agree with that?
Yes.
Okay. You've already shared with us the times that you were notified, right?
We saw it on the strip, in the records.
Yes,
But
ma'am.
this is pertaining to labor, because it's, talking about a cervical exam, discontinued Pitocin.
Well, that's in certain circumstances you would do that, right?
Right.
Objection.
Okay, if you flip on over to page 10 of 11, electronic fetal monitoring documentation, see H1 there? Reads, evaluate and document, including category, the fetal heart rate for low-risk mother and fetus every hour in latent phase. True?
Latent phase, that's referring to labor, so
Okay.
that's non-applicable here.
So although she was having contractions and Dr. Page said, get the baby out, you still wouldn't have to, in your view, evaluate and document the fetal heart rate every half hour.
Dr. Page didn't know whether the patient was in labor or anything. That's why he had her evaluated in the hospital, where the evaluation would have further either altered the treatment or supported exactly what was already recommended.
Okay. The evening of May 21st, 2012, where were you that evening? And what were you doing?
I don't recall.
No idea.
No idea.
Would the office records that you were talking about, would they indicate whether you worked that day, true? What your activity
They
was?
wouldn't have been in the evening or the afternoon, because I don't work in the evening or afternoon.
Okay. Do you keep any calendar?
Calendar,
Do you keep any calendar in 2012 that would say, where you were, what you're doing,
No.
anything like that? No idea what you.
no.
Do you have any recollection at all about where you were when you got the calls regarding Angel Mound?
No.
Okay, that's all I have.
Other questions, guys? Drew, Joe, Michael?
Just 7 hours per person, right? 'Cause no, I'm good.
I have one question for you, Dr. Whyte. When you were talking about your agreement with Tenet Healthcare Corporation that you signed back or that you had back in 2002, 2003, do you know if it was with Tenet Healthcare Corporation or it was with some other tenant?
I don't know, now that you say that. Did Tenet purchase South Fulton back then?
Well, I'm just saying, do you know what corporate entity it was with, whether it was with a Tenet Healthcare Corporation or some other tenant entity?
I'm thinking healthcare.
Do you know for sure which one it was?
What other one is there, so I
There are
can
multiple.
understand?
There are
Like,
multiple.
do they deal with healthcare?
Yes.
Oh, well, then I wouldn't know.
Okay. And one other thing, you said that you had a conversation with Ms. Mylan's significant other?
Yeah.
Okay, and what was that conversation?
I can't remember it all, but I remember the attitude was, it was antagonistic to her.
Okay.
Yeah.
You don't remember any of the specifics?
No, but it was antagonistic to her care, like everything that happened during the pregnancy. Like he was, I don't know, it may have been blame or fault finding. I can't remember details. But it wasn't supportive of anything against the hospital or any physician. It was almost like you knew this is not a surprise. In other words, because she was a substance abuser too, which was well documented throughout her history as well. So there were like multiple things that could have caused this.
I have nothing further.
Moses, do you have questions?
I'm not gonna be able to hear that.
We'll have to turn you up.
I'm not gonna be able to hear that.
Gene, can you see if this is plugged?
Can you talk now, Mo?
I can hear you. Let me know if you're having trouble hearing me.
Okay. Lisa, I'm gonna put you near the court reporter so she can hear you. So he can hear you.
Okay.
You got a wireless plug in.
And if you cannot hear my question, please let me know and I'll be happy to restate it.
Okay.
I want to make sure you and the court reporter can hear me.
Okay.
Okay.
Are we ready to go?
Yeah.
Yes.
Okay, great. Good afternoon, Dr. Whyte. My name is Moses Kim. It's a pleasure to meet you, and I do apologize in advance that I'm having to ask you questions over the phone.
That's
And,
okay.
I'm going to do my very best not to cover the same ground that's been covered already. In fact, I think these are just follow-up questions that haven't been fully addressed. And so I just got a few topics to go over with you. Okay?
Okay.
Okay. Dr. Whyte, would you agree that a patient's condition can change over the course of one shift?
Absolutely, because obstetrics is dynamic. It can change over a minute or two.
And would you agree that a patient's condition can change for the better, even over one shift?
Yes, because of hydration and rest, fetal rest, etc.
And in the same vein, a patient's condition can change even in the same shift for the worse, correct?
Yes.
And does that indicate to you that healthcare providers, including doctors
I'm sorry, I
and
didn't hear you.
nurses,
Start over, Mo, please.
The healthcare provider part.
I didn't hear it.
all right, let me restate it. Would you agree that because of the fact that the patient's condition can change so quickly that healthcare providers, including doctors and nurses, need to continually evaluate the patient and use their medical judgment in caring for patients?
Well, yeah, they do that through the information they gather from the nurse, correct?
And would you agree that what may be indicated at one moment may not be indicated at another moment if the patient's condition changes?
Absolutely.
And would you agree that with regard to whether a C-section should be done, that is a decision made by obstetrician specifically?
Yes.
Would you expect a labor and delivery room nurse to make the decision to have a C-section performed?
No, and I don't think that was done here either. They didn't do that.
Would
Yeah, I
you
made
agree
that.
would be, I'm sorry, go ahead.
Yeah, I made that decision over the phone.
Would the decision as to whether a C-section is performed or not be outside the scope of a labor and delivery room nurse?
No, they would know when a C-section possibly is indicated. I mean, they're not the doctor, so probably no, they need to consult with the physician.
In other words, nurses can't force an obstetrician to perform a C-section, correct?
No, they wouldn't force the obstetrician to, no. And that wasn't the situation here either, though.
And I want to move to a different topic about the fetal monitoring strips. Would you agree that fetal monitoring strips are subject to interpretation based upon who's reading them?
Absolutely.
And would you agree there's some degree of subjectiveness about interpreting fetal monitoring strips?
Absolutely.
Would you agree that because of this, one provider might say that a particular section of a fetal monitoring strip may be a Category 1 strip, while another healthcare provider may say that it's a Category 2 strip?
Absolutely.
And is that expected for practitioners who evaluate fetal monitoring strips?
Yes, unless you get a clear-cut ominous sign, then yes. And there are some of those.
I'm sorry, go ahead.
And there are some clear-cut that that the physicians will all agree on.
Sure. And in that same vein, fetal monitoring strips can also be subject to interpretation in that one healthcare provider might say it's a Category 2 strip, and another healthcare provider might say it's a Category 3 strip.
Absolutely.
Would you agree with that?
Absolutely.
And are you familiar with the way that ACOM defines a Category 3 strip?
Yes.
Are you familiar with the way that the organization called A1 defines a Category 3 strip?
Yes.
And the way they define it, which I'm representing to you, is that they say that a Category 3 strip is one that shows absent variability and any of the following: recurrent late deceleration, recurrent variable decelerations, or bradycardia. Do you understand what I'm saying?
Yes, absolutely.
And in any of the fetal monitoring strips that you looked at, did you ever see periods where there was absent variability and recurrent late deceleration, recurrent variable deceleration, or bradycardia?
No, there was only one questionable one, and or maybe two, but when we look at the fact that there wasn't a contraction with it, it was hard to really be certain about it.
So in other words, because the contraction is not picking up on the fetal monitor, you can't evaluate whether it's a variable or late deceleration.
Right, and they were very subtle. It was only a couple of them on 2 strips that were for like a couple of minutes. So sometimes it could be a fetal heart rate adjustment, but they did look concerning, but not, without a contraction, because she wasn't in labor, it would be hard to decipher which.
Children
Did
sit
you
there,
see
you
a sinus-sidal pattern anywhere on that fetal monitoring strip?
Hold on a minute, Moses, hold on.
What did you say?
We gotta stop.
Oh.
Yeah, sorry.
Let me know whenever you're ready to go again.
Hey, Moses,
Yes, sir.
How much longer do you think you have with Dr. Whyte?
Less than 10 minutes.
Okay.
All right. Hang tight, girl.
Are y'all ready?
Yes.
Dr. Whyte, do you recall seeing any sinusoidal pattern on the fetal monitoring strip?
Any what pattern? I'm sorry.
Sinusoidal. I don't know. Don't recall.
All right, I want to direct your attention to the AZT issue that was talked about early in the deposition.
Okay.
Do I understand that you did order AZT for Ms. Mylan?
Yes.
And do I understand correctly that order was taken down in the medical record at approximately 15:10?
15:20.
Or, excuse me, 15:20?
Yes.
And do you recall whether you made an order for AZT or did you order it stat? I'm sorry, let me ask a clear question. Did you order the AZT stat on May 21st, 2012?
We usually don't order it stat because stat means in less than 30 minutes. Like, in other words, the whole action is less than 30 minutes. So normally when we're telling somebody we need to get somebody ready for delivery, that's kind of, no, but I'm looking at the orders, it doesn't say stat, but someone took the verbal order, but it doesn't say stat.
I'm sorry, go ahead.
It doesn't say stat, but we normally wouldn't say stat unless there was a stat. I mean, you know, there was nothing emergent about the situation at the time. It was just that we needed to deliver her that afternoon or evening.
Understood. By the way, since I'm not able to see you in person, I can't tell when you're about to stop or start, so don't let me cut you off, okay?
Oh, no, that's fine.
And if you've got more to say, just let me know.
Okay. Oh, no, I'm done.
Ordinarily, how long would you expect a loading dose of AZT to take?
An hour.
And is it correct that the medical records indicate that the AZT was started around 1810?
Yes.
And so if Ms. Mylan was receiving an AZT dosage of 140 milliliters per hour, would it be your belief that the loading dose would have been completed within an hour of 1810?
Right, and then she needs 3 hours for it to infuse before the start of the C-section.
Were you physically available to do a C-section if you determined that it was medically indicated on May 21st or 22nd?
Absolutely. That's why the records indicate that I only took 20 minutes to get there.
And what I'm asking is from 1900 on May 21st, 2012 to 0600 or 0700 on May 22nd, 2012, were you available to perform a C-section at South Fulton Medical Center if you determined that it was medically necessary for Ms. Mylan and her baby?
Absolutely. Otherwise, I wouldn't have taken call from the colleague who was the one that was really on call by record.
Is it your testimony that had the AZT been started before 1810 that you would have come in to perform the C-section sometime on May 21st, 2012?
Absolutely. If it had been started shortly after, we would have been into a reasonable hour in the night to do something that's just scheduled and not emergent. And because of emergencies that are unforeseen and those that are seen, I wouldn't want to take the operating room up, which is only one operating room there, to be doing something scheduled.
But you're saying if it did turn into emergency, you could have come in and done the C-section?
Absolutely. Absolutely.
Would you agree that based upon fetal monitoring strips that we have available, that strip alone does not necessarily indicate a C-section during the night shift of May 21st, going into the 22nd in 2012?
I would say that. Because she had other assessments of fetal heart rate, of fetal status, so we weren't operating on that alone.
In other words, there weren't these ominous signs of absent variability and late or variable decelerations or bradycardia that would have classically indicated a C-section delivery on this night, correct?
Correct.
If you needed to call another obstetrician to perform Ms. Mylan's C-section delivery during the night shift of May 21st going into the 22nd in 2012, could you have done so that evening?
Yes, we have call group that we share with each other, and we help each other out all the time.
Would you agree that in terms of deciding when a C-section is indicated, that there are a multitude of factors a healthcare provider, namely an obstetrician, should take into account in coming to that decision?
Yes.
I mean, that might include the fetal monitoring strips, your personal observation of the mother, your evaluation of the fetus based upon any application, and a multitude of other factors, correct?
Yes.
I want to ask you about your prior testimony that had you been informed about contractions that you would have come to the hospital. Did I characterize your testimony correctly, first of all?
Yes, contractions meaning like she's in labor, because I stated to Attorney Potts that definitely and surely at term, patients can have contractions, irregular contractions. They can look regular initially, but they go away with IV fluid boluses, so those are not labor. So not just contractions, but it would have to be labor contractions.
Okay. And can you explain to us what you mean about labor contractions?
Well, contractions that reach a certain intensity and last a certain amount of time, and in a certain windows, like at least about 6 of them, and they're regular. They don't stop, like every 2 to 5 minutes or so.
And so all because there might be contractions, that alone would not necessarily have triggered you to come to the hospital during the night shift of May 21st going into the 22nd, correct?
In the way you phrase that, no. If there were just contractions, no.
We need labor contractions for you
Right.
to come to the hospital.
Right.
And the reason why I asked that is because the medical record indicates that the nurses informed you about some contractions during the night, but I understand that you don't recall that at all.
No, I don't recall that. But like I said, some contractions and not labor contractions, and then as they documented, there were no more after an hour or so, or half an hour. That's not labor.
Okay. And if you did determine that a mother did have labor contractions, would you be coming to the hospital purely to examine the mother, or with the intent to do a C-section at that point?
Let me hear that one more time.
If you did come to the determination that the mother was having labor contractions, would it be your intention to come to the hospital to evaluate the mother and potentially do a C-section?
Absolutely.
Or to actually perform a C-section at that time?
Absolutely. To make if she's in labor because of her HIV status, that is risk for transmission.
So having labor contractions alone would have indicated a C-section?
Yes. And not knowing her viral load and the non-compliance with the antiretroviral therapy. Several components.
Just give me a second here, I'm processing that information. So if a nurse tells you that the mother is having labor contractions, your plan of action at that moment in a situation like this would be to come to the hospital and deliver the baby?
Possibly, yes, because of a HIV positive patient that could possibly transmit HIV to the baby with the onset of labor.
And in the event that there were labor contractions at some point during the night, but the AZT had not been started or the full loading dose and the infusion had not been completed, could you still perform the C-section?
Absolutely, absolutely.
In other words, in the event of a medical emergency that indicated a C-section, could you have performed the C-section without the AZT?
Yeah, well, yes, because then you would be concerned more about life versus being HIV positive. So, you know.
So in this particular case, there wasn't a picture to you that there was a medical emergency that indicated a C-section
Absolutely.
during the night shift of May 21st going into the 22nd, 2012. Is that correct?
Correct.
Those are all the questions I have. I apologize I can't meet you in person. I very much wanted to, and I know you've had a long day, so thank you very much
Thank
for your
you.
time and patience with it.
Okay.
Gene, you got any read?
Thank you.
I have no questions. Any questions down there, guys?
No, sir.
Deposition concluded.
We are off the record at 6:14 p.m.